tissue can be a source of pain and limited mobility. Now, chiropractors will often use different massage techniques to help improve the mobility or improve the healing time of scar tissue. So if you're dealing with scar tissue, we're going to go over what it is and what you can do about it in today's video. Now, because we deal with a lot of injuries, we see a lot of scar tissue. So what is scar tissue? Scar tissue is naturally produced by the body after a surgery or an injury, typically, and we can see it in the skin, muscle, or bone. If you get a really bad cut or you have an incision, scar tissue will develop on the skin. You can see and sometimes feel that scar tissue. Now, if you pull a muscle, scar tissue will actually develop deep in that muscle as well. And if you fracture a bone, we develop scar tissue on the bone in the form of a callus as it begins to heal. Scar tissue is essentially just collagen that the body puts down to try to improve the healing of the damaged tissue. Now, when collagen normally gets put down in a healthy scenario, it's very organized. Those fibers are very organized and linear. When it gets put down over an injury, it's a little bit more scattered, and we tend to see a raised scar, especially in the case of the skin. But that disorganized collagen fiber can limit the mobility of the tissue and sometimes lead to some pain in the short term. Now, we can employ different techniques to scar tissue to help the mobility of the tissue, to help the healing process as well. In the case of the skin, I'm going to demonstrate in a moment how we can mobilize a scar to help the scar move better and heal quicker. In the case of muscles, we may want to do some stretching or some resistance exercise to get the muscle moving internally to help mobilize that scar tissue. And in the case of bone, we want to do some gradually higher impact activity to help improve the bone mineral density and improve the healing of that bone. Now, one thing you can do on your own for scars on the skin is you can help mobilize that tissue. And I'm going to show you how to do that in a second. And there's some techniques that we can do here to help improve the mobility and the healing of that tissue even further. But sometimes when scars have been there for a long time, or it's a really bad scar, it may cause issues elsewhere in the body. So if we're dealing with pain somewhere, we're going to be very acutely aware, is there a scar nearby that could be contributing to the lack of mobility or the pain that someone's feeling in an area? One common scar that we'll work on is C-section scars. Now, that is damage to the skin and muscle that has then healed, but we can see issues in the lower back, we can see issue in the pelvic floor from those C-section scars, and that can translate all over the body as well. If you have a scar on your elbow, that can lead to some wrist issues and so on and so forth. So if we have that scar tissue, we want to make sure that we are mobilizing it appropriately so it can heal and the body can function normally. So if you have a scar on your skin, here are a couple things that we can do to help get it moving better, help it heal quicker. So anytime there's a scar, we want to make sure that the skin has actually healed. We don't want to be working with any open wounds. So if we're working on a scar, it can be one that you've had recently, but the skin has healed, or one that's been there for a long time. So one way that we will get that area moving well is with cupping. So we'll use these little silicone cups here, and we'll place one on either end of the scar. And what that does is that just gives us purchase on the skin to be able to mobilize it back and forth. We'll go side to side, up and down, and in circles. And then as we progress through the care, we can actually have her go through some movements as well to better mobilize the skin and the scar tissue. Another mobilization technique is using a stainless steel instrument to help mobilize the tissue. So we're just going to be lightly scraping back and forth. Again, the scar has healed at this point. We're just trying to get better mobilization. And we can even go directly on top of the scar and just gently move it back and forth, just like that. So if you don't have access to any of these tools or a clinician that can help you out with this, you can do stuff at home as well. And all you're going to do is you're going to take the pads of your fingers, you're going to place them broadly on top of the scar, and you're going to move in 3 different directions. So you're going to go back and forth, up and down, and then you're going to go in circles. And make sure to do that across the length of the scar. Up and down, back and forth, and in circles. You're going to start with light pressure to begin with, and then gradually increase the pressure to your tolerance. So if you have a scar on your skin from surgery or an injury that you just need help with, or you've had a pulled muscle and you have that deeper scar tissue within the muscle, or you fractured a bone, stress fracture, or more of a traumatic fracture, you've got that callus forming, we want to make sure we can get you functioning and feeling at your best. So feel free to visit us online at TruMotionTherapy.com to learn more or schedule an appointment.